Channel 13 in Asheville, North Carolina, aired the interview of Secretary Doug Collins. In the interview, he dispels some of the rumors plaguing the Department of Veterans Affairs. He discusses the firings, staffing, and protesters. He also says one very important thing: you can't fix a broken system without changes.
Good.
Yeah, it's good to see y'all. Been a great day so far. I mean, I'm getting to come to Asheville. I've been on the road here for the last few days in Asheville today. And what we're seeing is really, I think, especially here at Asheville, a family community that is working. And I think that's a good part, because we always have a situation across the country and all in our VA system. When you get as large as we are, it's always good to see folks that are doing it well. That also doesn't mean we can't do it better. And I think that's one of the things that I'm emphasizing as I go forward here, is how do we take what is good in places like Asheville and Western North Carolina and make that something we can model elsewhere in the country. And look, there's a lot of discussions, and I'm going to answer some of your questions about what's going on right now. But at the heart of why I'm out here doing what I do is that I believe that the veteran has to be put first, just like they are here in Asheville. And the great team here at Asheville has been wonderful. The director on down, we appreciate the hospitality here and seeing the patients. I've had a great time actually visiting with patients in the room, listening to that. Communication is so vital when we look at where we're going and what we're doing. But when you have a task, it is about veterans. When you have a task, it's not simply about money and people. It's about also what is your mission, what is your culture, and how we do that. So for me, it's been about going and seeing our facilities, seeing what we're doing, and also putting the veteran back first. I've said this from day one of my time in office, that the veteran is going to be first at the VA. The VA exists for the veteran, and we're going to make that happen. Now, all along, are we going to have discussions and disagreements across the spectrum? Sure, we're going to do that. But at the end of the day, it's always going to be from my heart that is saying we got to take care of our veterans first, and we also got to put the right facilities in place and the right stuff, so that also our VA employee has the best equipment that they can have, that they can have the best tools that they can have to make sure that they do the work that they are partnering to do. And also making sure that our community partners out in the field, those that are helping us in other areas that we don't do, or that the veteran, who is our primary constituent, want to choose under the Mission Act. We're back looking at how we can better work that. We're going to convince them that there's great care in the VA, but we're also going to convince them if they go to the community that they're going to get that same VA standard of care, because that's what we expect not only of our people, but it's what we expect of those that come to be with us. So this is the kind of area that we're looking at. Now, as we go forward here, I know there's going to be some questions. I'll tell you what, I'll just save some of my answers for your questions, and we'll take a few here before I get on with the rest of the day. So with that, I'll be opening it up. Go right ahead.
Thank you, Secretary. I spoke with veterans yesterday, and you know this already from many reports, local and national. They're concerned. They're worried about specific cuts. Can you give us specific information? Will there be doctors cut? Will there be nurses cut? Will there be people that have to set appointments for veterans cut? Or is it focused on what Pete wrote us the other day, which was 2,400 probationary employees in non-critical positions, publicists, interior designers, and DEI officers? What can you say about Asheville that you're looking at right now for cuts?
I think for overall, I think here's what we're actually looking at. When you take into account what we have in our system, what we're looking at is making it more efficient for the veteran and making sure that we're doing the things that we need to be doing. So let's take this in perspective. When we look across the country, there's been 2,400 that was probationary fired across the department. These were probationary employees, many in just what you just said. You answered the question for me, and saying who were these folks, and some were here. I've gotten interesting information this morning, about 14 here at Asheville. There's nothing troubles me more than letting people go, but also at the same point, are we actually taking the funds and directing it toward patient care? And I think that's what's already happening. We've had hundreds of millions of dollars that are already being redirected toward patient care. But also, let's put this in perspective. And this is where it seems like, as a VA secretary, you get to go visit great hospitals like this and see everybody. That'd be what I spent most of my time doing. But what I spend most of my time doing is fighting innuendo and rumor. That's what I've been fighting, and I've been fighting from everything from members of Congress and the House and the Senate to labor unions to people who have vested interests, even VSOs saying, you're doing this. And they come out with what you just said, and this is why I'm here to say, quit scaring my veteran. Quit scaring my employees. We got a lot of change coming, and we're going to work together to have it. But when you tell me you're going to lay off doctors and lay off nurses, that's not even in our consideration right now. I need more good doctors. I need more good nurses. I need more who are taking care of people on the front line. You know where we're going to be looking? At the bureaucracy layer that goes from my doctor to the central office in Washington, D.C. We're going to be looking at contracts that we were paying for. By the way, 2% was all we looked at so far in contracts. And we found monies that came from that. We were paying people to write PowerPoints for us And meeting notes, that doesn't help my doctors help health care. That doesn't help them do what they're supposed to do. So let's put that in perspective. Also, that's 0.5% of our employees at this point. Now, as you look forward to a bigger rift, many of you have heard about this, we're going to start looking with our career employees. We've already started talking about that here. How do we know the areas that we need to look at to make sure that anything we do in a reduction in force goes toward not only making us more efficient, but also helping us out in making sure that patient care and benefits are taken care of. Now, let me just make one thing clear, and if you have a question about this, I'm going to answer it real clearly right now. Health care and benefits are not being cut. They're not. Most of that is statutory, if you know. That's not something we're going to cut in the sense of what's being said. But I have people out there on the outside, even probably out here in the front today, saying, you're cutting benefits. No. Quit lying. That's all I got to say is quit lying and do it from there.
Could you tell us, or could someone here at the VA in Asheville tell us what were those 14 or 15 jobs that were cut?
We did.
Here?
There was an executive assistant, there was interior designers, there was also some stock clerks, which, by the way, we got some information on today that we're actually looking at. Because not just the probationary, there was the fork in the road, the DRP, the early retirement. So we're finding out information that says maybe we can look better to help firm up our supply chain here. And that was one of the great things that we had here looking at. That's why I'm here. Folks, you don't have an organization as large as we are and not have things that in the bureaucracy, and that's what I found today. The bureaucracy may have kept us from knowing some information that help us now to come back and fix it. So when you look at this, again, here's an interesting thing that I'll just say to all of you. It's amazing to me that they've had stories out in the media lately about appointments, wait time. Well, we've had wait times here in the VA since we've been in the VA. By the way, if you go to the private hospital over here, guess what they've got? Wait times as well. Those have been a problem. They said, well, surgeries were canceled or something was done. Folks, if you'd have been here on January 15th, you wouldn't have been asking me about that because it's been happening in the VA for a while. If you hadn't realized, VA became what I call the whipping post for most of life. Everybody wants to complain about the VA. Even good ones like Asheville get lumped in to everything else. But yet the minute somebody says, let's change something, oh, you can't touch that. So let me just tell outside folks, I'm going to work hard to take care of the VA employee, but the veteran first, and I'm going to challenge anybody that you can't tell me that the things are bad. And 60% of the calls to congressional offices saying we need help to getting to the VA benefits or getting VA health, and then tell me we can't change anything. What you're telling me, that's what these folks on the Hill and in other places are telling you is don't change anything. We like the status quo. I'm not happy with the status quo. Next question.
I have a question.
Yes.
So there are protesters outside with signs. One says, keep VA staff in response to the 15% cut that's coming across the nation. What is your message to those protesters outside?
My concern is one, I have every concern for staff and others, veterans and all who are included in that. And I understand that we have a great facility here that they love. My question is, can we make it better? Instead of yelling and protesting, I would encourage, that's a great First Amendment right, God bless America. But at the end of the day, what are we doing to fix the system? What are we doing to make sure that I have a health management, records management system here that is so outdated that we're not even in basically a modern world when it comes to somebody being able to use their phone or stuff to get the help or the appointments or their medication? Where are the same folks that, again, for 10 years, the GAO, Government Accounting Agency, has said that the VA is on the high risk list? 10 years, ladies and gentlemen. 10 years. And you know what we've done? We've thrown money and we've thrown people. In the last 4 years, we spent and put tens of millions of dollars, almost billions of dollars, into the budget of the VA, and we spent tens of thousands of employees into it. And you know what? Our metrics across the system have actually decreased. From wait times to also benefits and disability packages. They went from lows of under 60,000 to 225,000. All I would tell them out there is work with me in this. Change is going to come in life no matter what, and it comes everywhere. But also, and I've heard this as well, you got veterans who were let go, veterans who were not. When we did the probationary firings, number one, there was some exemption system, which actually was used here and is successfully used. There was some here that we're now going to take another look at. But everyone had an exemption process that they could go through. And we put back a large number, hundreds of people who first off were cut, but we said, no, after looking at this, we're going to make sure that they're staying. But also in this as well, for those who didn't, we're finding a lot that their supervisors never put in exemptions for them. So they're just saying, so again, that question to me is what were they doing out there? So for all the protesters out there, one, as someone who served for their right to be out there and protest, God bless America. But then I got a question for you. When you put the signs down, what are you going to do to help me? Yes.
Laura Hackett with Blue Ridge Public Radio.
Hey, Laura.
What investments, so it sounds like you're wanting to save money by these staffing cuts. Where do you want that? It sounds like you have investments that you want to put back into the VA. What do you want to invest in?
Oh my goodness.
Group services specifically.
Where we're already putting it back into our community care budgets, back into our facilities issues where we got facilities that are worn, even here that there's possibilities we could move that money in. How about we move it toward recruiting and hiring doctors and nurses and making our facilities so that they don't have the shortages in staffing that every hospital around here. By the way, again, it's amazing to me. We want to write the story about the government doing it, but nobody has wrote a story yet about a veteran getting fired at Southwest Airlines when they took 15% of their workforce out, or CNN cut 6% of their workforce out. They don't want to do it because we believe in some ways the government is this different entity. Look, folks, it comes out of your and my tax dollars. Are we doing it efficiently? So prosthetics, suicide prevention. This is another issue for me. We're spending $3 billion a year on suicide prevention, and yet our numbers have basically stayed the same. No real thought consciousness would say that that's a good thing. We got great people doing great things with our suicide prevention, but is there better ways to do it? Because we're spending $588 million on prevention. $588 million on prevention. And we're still staying between 17 and 40, depending on what number you want to look at. I don't accept that. As a veteran, I don't accept that. I want to find better ways, and I'll partner with anybody willing to help us. So those are the areas that I'm looking to put it back in. Prosthetics, surgeries, those are the kind of things we need to put this back into.
Wait, so you want to put money, you want to cut money from suicide
We're taking
prevention?
money. Well, we're taking that money and better spending. If I gave you $500 and you get the same results on everything, are you going to just continue to do the same thing if you're wanting to improve? The answer would be no. Unless you're not wanting to improve. I want to get that number down. Did y'all realize in the media that I'll use a 17 number, but it's the same percentage probably as you going up, that out of those 17, 50% have never had contact with the VA? 50%. Why is that? Are we not reaching them? Are we not hitting them? Are we not going where they are? So that's why I'm doing podcasts. I'm doing media. I'm sitting here every time I go to an event like this and talking to you. I need your help. If you're a veteran watching me today and you're in crisis, look, call us. We want to help. But if you're there, find somebody. Find your battle buddy. Find your wingman. Find somebody to talk to. That's what we've got to do better on. Next question.
Are you
Yes.
seeking, Greg Perler, Mount Express.
Hey, Greg.
Are you seeking to, do you have a vision to privatize segments of the VA?
No, that's also the other thing that's thrown out there all the time. Well, Doug wants to use community care. We're going to privatize. We're not privatizing anything. VA care paid for by the VA is VA care. Let me get that very clear. If we do it in this shop or we do it with our contracts and we do it with our community care, we're going to be high to the highest standards out there because that's what the government and what the people expect. When you have government and people expecting that, that's what we got to have. Look, privatization will not solve this issue, and I've told the senators this, and I've even told members of the House who believe, let's do privatization. I've told veterans, privatization. There's not enough room in our systems outside the VA to take care of. The VA has a wonderful start of helping veterans in areas where hospitals didn't exist when we first started this. The same thing is true today. Can you imagine if this wonderful facility right here had to take all the patients that it had and they had to then put it into the system that is out there in Asheville and the surrounding areas? We would have a crisis here. So no, but we can do a better job partnering. We can use our resources better. Those are the kind of things that we're looking at. I got time for one more.
Jacob, Assistant Todd.
Hey, Jay.
I apologize. This is clarification on the answer you gave Laura.
Yeah.
Are you suggesting that less money should be spent on suicide prevention to lower the suicide
No,
rate?
I'm not sure where we're getting less money being spent. What I'm saying is we're spending $588 million. Are we doing it effectively? Let me make this clear. I'll foot stomp this all day long. I want you to understand something. If I'm going to spend $588 million, I'll spend $1 billion to save one life. Hear me clearly. But if that is not being effective, if $588 million is not being effective, then let's take the programs, let's take the outreach we're using, and maybe redirect that $588 million to suicide prevention programs that are working. Have I made myself very clear there? Because I don't want any misconstruing on that one. I'll fight that one all day long. We're not cutting suicide prevention. We're making it more effective. I'll use the $508 million to say, are we reaching a veteran? Wouldn't that make sense, folks? And if we're seeing the numbers stay the same, then maybe we're not doing that. So for all of you out there, and for those watching today, I'm glad you're here. I appreciate it. And my job would be, I love my job. I'm here for four years. The president wants me to stay to do one thing, make us better. And at the end of the day, say he made a difference. But I can't do that keeping everything the same. So for all the stories out there saying, oh, this is going to be that, listen to me. Follow me on social media. Follow what we do. I'm the most accessible VA secretary you've had. Now, you can disagree with me. You can protest. You can do all the things. But at the end of the day, my question to all of you out there, especially in Western North Carolina, is this North Georgia boy, get in the boat and help me paddle. Let's make this the best we can. Thank y'all so much.